Okay, so now for the good news. Number one, after I decided to body slam myself out of the bed, so far no signs of any paralysis. I can still walk. My leg swelling has gone down tremendously because I was really worried about compartment syndrome because they were like really hard, my calves and shin and everything. I have not counted the bruises yet. I figure that could be a fun game for me and my aide on Monday. But the good news. Well, maybe good news because it involves multiple injections that I'm trying to figure out how I'm going to manage. So, I finally pulled the plug. We are going for Anakinra. My not only is my Yao syndrome like causing considerable damage to my body still. You can see my eyelids. My cheeks are not bad. I don't know about my neck. I don't know if you can see. And I need to be careful moving my neck because I probably should be wearing my neck brace because I did get whiplash from the fall. But anyways, so the first good news is I did some research. No doctor recommended this. But I have this hole in my spine right now from the osteomyelitis, eating the disc and eating part of T10 and T11. With Fosamax, I was only getting no bone loss. I wasn't gaining bone density. I did some research. Did you know there are medications that actually help you build bone? We are going to have to watch my calcium levels because I'm on an insane amount of calcium right now. And some of that's due to malabsorption and some of that was because of what Fosamax did to me. So we're definitely going to have to watch my calcium levels. But it's a daily injection. It's called Forteo. I am taking the generic. It is hard to find places to inject both Forteo, the GPL1, so on Ozempic. I'm going up 2 clicks a week. I'm trying to get to the starting dose, and then I'm probably going to stay there for a couple weeks just because my stomach is freaking killing me. It is mostly the other way. And some of it is what I'm eating. I'm trying to eat better, but when you are bedridden and somebody else does the majority of your cooking, you don't always get a choice on what you eat. So I've been trying to make sure I add extra protein to all my meals. And one of the things I've been using is meal boosters. I'll tell you more about those later. But we are going for Anakinra. Because my joints have been so bad in my hands, I don't know if you can see. Oh, I can't see it with a filter. But anyways, my hands and my wrists, particularly, and they're turning purple like they did when I had JIA as a child. We are going under adult Still's disease, adult onset Still's disease, because everything for Yao syndrome is experimental. So getting it approved for Yao syndrome would be like literally pulling teeth. Unfortunately, I waited too long to pull the plug on Anakinra. I mean, I didn't have a choice. I had osteomyelitis. We had to make sure that it wasn't coming back, that it was healing good, all that shit. We were hoping the GPL1 would lower my inflammatory enough that I could avoid it. Especially where I'm on the sulfasalazine and the colchicine and the Celebrex. It didn't, and in some of it might be how slow I have to go because of the gastroparesis. But also, I think this is more the metabolic is what the issue is. So my last CRP was 119. I think my ESR was either 53 or 57. My LDH was 245 and my aldolase was 9.9. I sent him, tried to get him to order the PET scan because Sadie, my autonomic neurologist, wants me to get a PET scan just to make sure with the neurogenic fevers that it's not cancer and blah blah blah. But he wants to wait for hematology. I wanted to get it done because I also wanted to look for inflammatory myopathies with the aldolase being elevated. But I tried. You can't blame a woman for trying. Maybe I'm seeing the immune deficiency doctor the second, so maybe she'll do the blood with the peripheral smear. If not, I'm seeing hematology in like the first week in July, or I think it's July 6th, so it might be the second week in July. And then I'm going for the liver biopsy on July 8th, and I'm probably not starting this until after that. I'm pretty sure I have Durkheim's. I have getting diagnosed with it as a pain in the butt, but I'm pretty sure I have Durkheim's. And I have lumps in my fat in my belly and in my, especially in my legs. My thighs are like rock hard. I did do my I can't pronounce the generic, the Forteo in my thigh yesterday, and that was a little hard. I'm trying because I've been following some of the research on GPL1s, and those ones particularly, you got to be careful about putting it in lipodystrophy tissue because it won't absorb properly. Oh, and I got Dupixent too. So I'm going to be a walking bruise, never mind my fall, but I'm really hoping and praying that Anakinra and the IVIG will finally help me turn the corner. The Forteo, so you're supposed to have a 3 to 6 month washout period before starting Forteo with the Fosamax. And of course, this all happened during my unpredicted small washout period because my doctor kept sending the prescription to the local pharmacy and not CVS specialty. That was a whole other nightmare. But they finally got it, and I finally got it. So, speaking of which, I probably need to take Dupixent out. What's weird with Forteo is they have you inject it cold. Like everything else I have, you take it out, you let it warm up for 30 minutes. This, you're supposed to inject it and return it right to the fridge. Like, I've never had an injection like that. It doesn't hurt. Usually if you inject it cold, it hurts. But so far, it hasn't hurt. So, that's the good news. So the good news is, hopefully we can get my inflammation under control between the Anakinra and the GPL1. Hopefully, eventually, I can get off the sulfazinazine and maybe even the colchicine. And I mean, I still plan to do the Ozempic. I might eventually try Mounjaro because I do know that that's what they're studying in long COVID. But we decided to go with Ozempic just because I'm already having so many side effects, and with my gastroparesis and GI dysmotility, we thought like getting me to tolerate one was more important than going with the more powerful one. So, but yeah, I've been mostly sleeping the last 2 days, probably recovering from my fall. But yeah, that's the good news. I finally pulled the plug, and we talked about a diagnosis to get it covered, and I'm weaning the diazepam. Oh, that's a whole other freaking video. Well, let me tell you. Hopefully it will get better once I talk to my PCP. I've had some episodes of borderline SVT. We increased my evaporine. We're talking about a loop monitor. But, and I'm going to go get vascular compressions ruled out as a reason for some of these issues with my heart rate, blood pressure, and autonomic. So, yeah, I'm slowly getting better. I am probably going to be looking for a local pain clinic to do the trigger points because if they're not going to document properly, it doesn't make sense to continue going to Boston.